Alrighty, good afternoon, everybody. We're going to begin our press briefing. We're back until further notice, but because of our condition here in Nueces County with the large number of cases that we've seen, really for the past 2 weeks, we thought it would be important to start briefing the community on a daily basis rather than a twice a week basis. So we'll be here this week, Monday through Thursday. Friday is a city holiday, a county holiday as well, in recognition of the 4th of July. And so we won't be here, but we will be reporting out on our website for those days. And but we'll be here Monday through Thursday this week at the 5 o'clock time frame. Thursday will include our normal briefing, but we'll also have time for Texas A&M Corpus Christi's update that they've been providing to the community. So we want to thank those that are watching, either from some of our network broadcasts, we appreciate them being here today, or some of the live feed, to include from the Caller Times, our own Facebook channel, and our YouTube as well. So I'm going to provide an update on some of the statistics, and then we'll have a video from Annette Rodriguez, our Public Health Director. And then with us today also is Nueces County Judge Barbara Canales and Mayor Joe McComb, and they'll provide some updates as well. Okay, so let's begin with the statistics. Today, you can see in the far right, we're reporting 205 additional new cases today. Now, that's a lot of cases given that there has been no drive-through testing or any testing operation of significance. And so last week when we were seeing the 259, the 228, some of those peak days, the city and others were conducting some pretty significant drive-through testing operations. But today the 205 comes from some of the residual tests that have been done from hospitals, some of the private tests, and you can see the number is pretty large. And so that's pretty worrisome. In the last 7 days, the seventh day being the 71. Now go back, please. If somebody can go back on that slide. That was the seventh day. So if you look at the 71 through the 205, the total amount of cases in the last 7 days is just under 1,400. So it's 1,378 to be exact. Okay, so those are the numbers. You can see some of the numbers from the prior week. You can see we obviously have a significant outbreak happening. On the testing, before we turn the slide here, we were going to do a drive-through testing tomorrow. The city county health district was going to. It was going to be at Concrete Street. And that testing operation will be delayed because we have to send that same staff to several outbreak areas that are happening right now at some of our nursing homes, as well as at the Corpus Christi State Living Center. And not only is it being canceled for those purposes where we have to send the people out, but our supplies that we use to conduct the tests and analyze the material are in limited supply. They're limited. We do have a request out to the state through the city and the county and our legislators to get us more supplies. But until they come in, we're down to a certain number of material. And so we want to reserve that for some of these senior nursing homes and the living center, the state living center, where some significant outbreaks are going on right now. So the Concrete Street drive-through testing operation will be announced. Hopefully it will be this week, but that will depend on those supplies, and we'll keep the community posted. We know that there's several thousand, like 2,000, that want to be tested, and we were going to test a significant number tomorrow, but that will be delayed slightly because of these outbreak situations that have taken place. Okay, let's look at the donut chart that we refer to. You can see in the darker blue, the 1,840 right here. That number is our active cases, and that is nearly 90% of all the cases are active. So that's why people need to quarantine and self-isolate once they have the case, because with this many people having the virus, if they're exposing themselves to other people, that just causes that ripple effect in more cases. So nearly 90% are in the active state, 1,840. There are 272 that are recovered. You'll notice the number of deaths this afternoon is at 8. So we have 8 deaths, and that grew by 1 from last night. We had a death of a 50-year-old man that did have, in the 50-year-old range, I should say. And the person did have comorbidities, but nonetheless, we're sorry that there was another death last night. I'm going to show you another chart later on deaths to help put it in perspective. Okay, hospitalization, that's another issue of concern on our next chart. And we have had in the past 7 days a 350% increase in the number of persons hospitalized. Right, so today there's 93 people in the hospital, you can see in the far right. And if we look back 7 days when there was 26, that's a 350% increase in hospitalizations. So yesterday I did speak with the director of our area authority that helps manage hospital beds and ventilators and that type of stuff, Hillary Watt, and hospitals are being strained. The issue really is nursing staff at this point. And so there's enough beds and there's enough ventilators, but there's a shortage of people to help, or nurses I should say, to help manage the patient in the bed with the ventilator. So there is a request out, and additional nursing staff are being sent here from across the state, but it's a problem statewide. So at this point, we're watching hospitals closely. We're not in a critical point, but we're getting close with respect to that. Number of persons in ICU is continuing to increase as well. It increased by 11 from just yesterday on our next chart. And so there's 29 people in ICU this afternoon, and there was 18 yesterday, so that's a 11-person jump in persons in ICU. This is that chart on deaths. You can see, I wanted to show it to you. I know it may not be as crystal clear, it's just a line, but it shows the date on the bottom, and these are the number of deaths. And so the key thing to point out is that for the 3 months of March, April, and May, for those 3 months, we only had 3 deaths. But in the past 2 weeks, in June, we've seen 5 deaths. Right, so our death rate is 8 persons. While it's not a big number, the worrisome part is 5 deaths in the last 2 weeks, where 3 months passed and we only had 3 deaths in total. So it just reminds us that this disease or this virus is deadly, and we need to do all we can do to not get it. Okay, let's look at some 7-day averaging. And so this next graph is on testing. You can see the blue bars going up and down of the actual number of tests performed. But for those that are watching this closely, testing reported doesn't necessarily mean it was done that day. There's a general lag time from between when the test is taken to when they tell the city county health district that the test was conducted. So keep that in mind as we look at this, that the testing is still kind of a lagging indicator. Tests that were taking place some days ago at Spahn Hospital, as an example, aren't reported to the city until a few days later because of constraints on everything they're trying to do. But what you can see is the orange line is the 7-day average, and we have 522 is the average number of tests that are conducted in a 1 day based on a 7-day average. So that's a good thing. There's a lot of tests being performed. And then let's look at the 7-day average for cases. And so you can see since the beginning, the blue bars are kind of hidden under this average, but you can see in the far right, those are the number of new cases. These are COVID cases, positive cases. And Dr. Bird, who's here, I know a lot of people watching know him and respect what he tells us. He talks about 3 waves. And it's a little bit hard to see, but there was a wave back here initially when we were first tracking this. Our second wave was here. And that was caused by some of the outbreaks that we had at the beef processing plant and some of our nursing homes. But you can clearly see we're now past a wave and kind of into the tsunami situation, as Dr. Bird referred to it, way over here. All right, so that just puts it in perspective. The next chart shows it one more time. The 7-day average, you can see where we're at in 626, actually 629, that the spike, and you can see the second wave and the kind of the first wave. Okay, so that concludes my portion of the briefing. I have to look at this while I report it to you, but there is testing that still continues to take place. And while the health district, we temporarily are rescheduling the one we had yesterday, there are persons that are testing still. So Amistad Community Health Center, they have been testing Monday through Friday. That's by appointment only. Okay, Amistad Community Health Center. Another one is the Coastal Bend Wellness Foundation. They're testing Monday through Friday. CVS Pharmacy is now a COVID-19 test collection site, and they will be testing daily, but similarly, it's by appointment only. So call your CVS if you want to use them. You want to get an appointment though. Physicians Premier is a COVID test collection site, and they will test daily at any location, but by appointment only. Okay, so Physicians Premier. And then Prompt2, PROMPTU, Urgent Care, is another test collection site, and they're testing daily, but by appointment only. And so any one of these 1, 2, 3, 4, 5 places, you need to call them. You could probably get their number just by their title and get an appointment set up if you want to get tested. If you were already scheduled for a test with the Corpus Christi, Nueces County Health District at the Concrete Street Amphitheater, that is going to be changed. You'll be getting a notice. Hopefully it will be this week. And then also, I mean, the hospitals, if you went into a hospital, which we don't recommend because you could infect a population, or your own primary care physician, they do testing as well. So the key thing is, if you feel sick, is isolate, number 1. Number 2, call one of these places or your primary physician and try to get a test scheduled to see if you have the virus or not. Okay, so with that, Gabby's going to do some translating, and then we're going to watch a video from our Public Health Director, Annette Rodriguez, and then we'll be followed by Nueces County Judge Barbara Canales and Mayor Joe McComb. Thank you.
En resumen, las cifras más recientes indican que en las últimas 24 horas se han reportado 205 casos confirmados por el coronavirus, haciendo un total de 1,840 casos. Tan solo en los últimos 7 días se reportaron 1,378 casos. 272 de los 1,840 casos se han recuperado por completo. 93 personas continúan en el hospital. 11 personas en la unidad de cuidados intensivos. Hace solamente una semana eran 26 los pacientes hospitalizados. Esta semana son 93. A la fecha se reportan 8 fallecimientos. El más reciente fue anoche un hombre en sus años 50. Las pruebas que se iban a realizar en el Concrete Street van a ser pospuestas debido a la falta de personal, ya que se va a utilizar ese personal para realizar toma de muestras en otros lugares donde han habido brotes. Esperamos realizar la toma en el Concrete Street a finales de la semana. En cuanto tengamos información, se la daremos a conocer. Hemos estado en contacto también con hospitales, ya que pudiéramos contar con una escasez de personal médico, pero estamos viendo todas nuestras opciones. Continuamos realizando las tomas de especímenes, pero existen otros lugares como la Clínica Amistad, la Fundación Coastal Bend Wellness, la Farmacia CVS, Physicians Premier, en cualquiera de sus ubicaciones, y Prompt2 Urgent Care. Las tomas son solamente con cita.
Good afternoon. Annette Rodriguez, Public Health Director. COVID-19 cases continue to increase rapidly in Nueces County. The week ending of June 19th, we had 212 cases. This past week, ending in June 26th, we had almost 1,000 cases. To be exact, 951 cases. That's 5 times the number of positive cases from the previous week. This exponential growth is disconcerting to those of us in our community, but also to those in the surrounding towns, as well as in Texas and across the whole United States. As our number of positive COVID cases increases rapidly, so do our number of hospitalizations. And when hospitalizations increase, it is inevitable that deaths too will increase. As you've heard, we had 2 additional deaths over the weekend. These individuals, while both hospitalized, were both male patients. One was in his 70s and one was in his 50s. These individuals also had comorbidities, like many individuals in our population do have, but only God knows if they had not contracted COVID-19, would they still be with us here today. Our sincerest condolences go out to their families and to their friends. The rate of spread is alarming and must be curtailed, but there are simple things that we can do to decrease the spread of the virus. So first, stay at home. If you are a vulnerable population, take this time to stay indoors. Stay at home, have family come and drop off groceries for you. Utilize your grandkids to help you do those things. This is a good time to have family help you. Stay at home. That's how you are going to protect yourself. Number 2, stay distanced from strangers. 6 feet is great. 10 feet is better. 15, 20 feet is even better than 6. Stay distanced from strangers. You say, well, I know those individuals. Can I go and speak to them? If they are not part of your household, the answer is no. Stay distanced. You don't know if they have the virus or they're carriers, and you definitely don't want to spread that to them. The third one is stay protected. Wear a mask. Cover your nose and mouth when you're out in the community. You do not want to spread a virus. Hopefully you don't have it, but you don't know that until you actually have the virus. And you actually don't want to pick up the virus from respiratory droplets either. So wear your mask whenever you're outside of your home. The number of coronavirus cases will continue to rise if the whole community does not do their part. This message is specifically for the young, 25 years of age and younger. You are correct in thinking that if I get coronavirus, I may not be very sick. That's correct. But you do spread the virus, and you could actually spread it to somebody that's vulnerable, that ends up hospitalized, and even ends up in critical condition. We are all certain that our young population is not intentionally wanting to get anybody sick, but our young population also needs to do their part and be responsible and be righteous. I believe in them, and I hope you too encourage them to practice safe behaviors. If you are found to have COVID-19, stay in isolation for 14 days. That is required. Isolation is required for anyone that tests positive for 14 days. Quarantine, on the other hand, is for those individuals that come in contact with the positive case. If you're found to be COVID-19 positive, you must notify your employer, your coworkers, and your friends that you are positive with the virus so that they may quarantine themselves. You are required to self-isolate for 14 days, but they are required to quarantine themselves for 14 days. If you are a contact to a positive case, you must quarantine. That means that those tested positive must be quarantined for the 2 full weeks, even if you are not sick. We have many people that say, I don't need to be quarantined. Yes, I was in contact with the COVID-19 positive, but I do not need to be quarantined because I'm not sick. That is the incubation period that you're in. The incubation period is a 2 to 14 day window that when you were with somebody that now they have COVID-19, Those 2 to 14-day time period is the time period when you can actually pick up this virus. So that's the time period that we require that you stay in quarantine. What is quarantine? I'm in my house, I'm staying here, I'm making sure that I'm not around anybody, I'm not going out, I'm not going to the middle of the grocery stores, I'm not doing anything where people are inviting me to their homes, to parties. I'm staying at home and I'm quarantining myself from those individuals. COVID-19 may cause severe inflammation inside of some individuals, while others may only have a mild respiratory symptom. They might just have something that feels like a cold. The problem is that we don't know who is going to get which one. And so everybody needs to protect themselves from this virus. But what we do know is that the vulnerable populations, and these are individuals that are diabetic, these are individuals with dementia, with asthma, with chronic obstructive pulmonary disease, or even those that battle being overweight, have more severe bouts with this coronavirus. If you and your contacts will all do the right thing and stay isolated and quarantined for the required time period, this virus will not continue to spread as rapidly as we are seeing it currently being spread. Finally, together, all of us, practicing responsible behaviors such as washing our hands often for 20 seconds at least. Also, social distancing from strangers, staying at home if at all possible, not touching our eyes, nose, and mouth with dirty hands so as not to infect ourselves. Practicing good hygienic and respiratory practices will help navigate us all out of this COVID-19 pandemic. Stay healthy, stay protected, and as always, stay informed. Thank you.
En resumen, los casos por el COVID-19 continúan incrementando. Estos aumentos nos preocupan, no solo en nuestra área, sino en todo el país. Nos preocupan las hospitalizaciones y sobre todo los fallecimientos. 2 tan solo el fin de semana. Y aunque ambos tenían problemas de salud, si no hubieran contraído el COVID-19, posiblemente hubieran sobrevivido. Recuerde estar en casa, practique el distanciamiento social, especialmente si son desconocidos. Protéjase, use un cubrebocas, evite propagar el virus si acaso lo tiene y no lo sabe. Sobre todo un mensaje para la gente joven. Si cuenta con el virus, tal vez no se enferme como una persona mayor, pero eviten propagar el virus. Aquellos que han sido diagnosticados positivos deben de hacer cuarentena por 14 días. Avise a su empleador, no debe de estar en la comunidad aunque no tenga síntomas. El periodo de incubación del virus es de 2 a 14 días, por lo que se le requiere estar en su casa y no salir a ningún lugar, así evitar contagios. Cada persona reacciona de forma diferente al virus. Unos se enferman más que otros, especialmente aquellos con obesidad. Si usted está enfermo y bajo cuarentena, evitará que el virus continúe propagándose.
Good afternoon, everyone. I was just making the comment back and forth to Manager Zanoni that was a great video by Director Rodriguez, mainly because it had such valuable information. And it seems like, there's so much information, and it sometimes can be confusing, and it often appears conflicting. Her message was directly on point, and I think that we're going to make sure that video gets posted to our website, both at the city and the county. So if you said to yourself, boy, that was great information, I'm going to forward that video, you're going to have the opportunity to do so. Today, I want to focus on one really important subject matter, and that is a call to action. So this weekend, our health authority, Dr. Ram, who I have so much admiration and respect for, called me and said, we need your help. Those are the words that any elected sometimes both dreads to hear, because that means trouble, and also creates inspiration. And so while I recognize that those are words that signal alarm and concern, I know I also am up to the task, because I have all of you. And so here is the call to action. There are many people who have recovered in our community. In fact, if I saw the chart correctly, it was 272. We need those folks who were diagnosed with COVID-19 and who have recovered successfully to please consider being a donor today. We need blood desperately in our community to initiate the convalescent plasma therapy treatment that we know shows tremendous success and helps take those hospitalizations and bring them down. And that's what's needed and required today. You saw the statistics. We grew by 400% in the last week and a half. I don't even know what to say about a number that's 400% growth, except for that there's only one place to go, and that's down. We've got to go down. And in order to do that, we need some help. And so I've got a number here on the wall on our PowerPoint, 888-0264. That's going to ring to our office at the county judge's office, and we are going to be your patient navigators. You won't have to be bothered with too much difficulty because we're going to help you set up the appointment at a convenient time. We're going to explain the process, and we want you to be a hero. For every person that can donate blood, we can save 2 lives. And so I'm calling on everybody listening to this right now. Do you know somebody who recovered from COVID? Will you share the information today? It's our goal to produce 100 donors by the end of this week. 100 donors. I am so convinced that we can not only help save lives, but we can show what kind of a community spirit we have here in Nueces County. Yes, we're in peril. We are the #1 county in growth per capita, but we also can be #1 in being heroes for those folks that are struggling in our hospital. So I invite you to, if you want to know more about the therapy, I have the website that has an amazing link to convalescent plasma therapy, but really all you need to know is it's just like being a giver, a donor for blood. And then the blood bank does all the hard work of taking out and extracting that plasma. And then the doctors take it from there and create the treatment that saves lives. So once again, share this information and link. Of course, there's some rules. You have to be fully recovered for 14 days after your positive diagnosis and symptom-free for 72 hours. In addition, you'll have to pass a small health screening to make sure you're in good shape to give blood. That's always the case. But mark our words, we will make the process easy and seamless for you. And again, if you have any question, call the county judge's office at 888-0444. But if you're ready to be a donor today, this is the number you call, 888-0264. In addition, I've been pivoting to another subject matter. I have been fielding a lot of calls still about beaches, and I still want to remind the audience listening that our beaches are governed by the General Land Office. And while we have an excellent relationship with them, they call the shots, and we are grateful for their guidance and their counseling. And we have reached out to them, as you know, last week, and we are still awaiting word as to where we're going to, what kind of authority we might have for certain restrictions that will help us stay safer this holiday season. I also want to share with you that it came to my attention this afternoon that the Nueces County Hospital District has an office at the Dr. Hector P. Garcia Wellness Center, and this office has had to be shut down temporarily due to some exposure of some employees testing positive. I know they have diverted to the Ropstown location and also the Greenwood location, and so it's not like the Nueces County Hospital District will not be able to tend to you or to receive your inquiries. It's just the office at the Dr. Hector P. Garcia Wellness Center will be temporarily closed. Again, I stand available to answer any of your questions, but today it's all about being a hero. And so for some of you that recovered, you might have had a terrible time with COVID, and now you're completely well. And those of you that were completely asymptomatic and were some of the lucky ones, this is your chance to really give back. And we need you more than ever. And as I said, I'm willing myself to drive anybody to the blood bank. So we're going to make sure that we have rides for you. We're going to make sure that we help you with the forms and that we help you with the appointment. And we've called this Operation Mother Hen because we're not only going to make sure you get to your appointment, we're going to make sure that you're thanked for doing your part. And there are some nice incentives that the Corpus Christi Blood Bank is giving out for those donors. But the greatest incentive, the best one of all, is knowing that you're a part of doing something that most of us desperately wish we could do. And that's help these healthcare workers, these frontline heroes, save a life. I can't do that because I haven't had COVID-19, but if you have, you can. So let us help you by getting this very precious gift of life to the right spot. Thank you so much.
En resumen, hoy quiero enfocarme en las acciones que vamos a tomar. El Dr. Ram, la autoridad de salud, estuvo en contacto conmigo y es que han habido 272 personas que se han recuperado del virus exitosamente, por lo que le pedimos que done su plasma para poder así atender médicamente a las personas más enfermas. Le pedimos llamar a la oficina del juez del condado al número 888-0264, ya que nosotros le vamos a ayudar con los trámites para que realice así una donación. Para más información también puede ir al portal de internet a la dirección coastalbendbloodcenter.org. En cuanto a las playas, sigo recibiendo muchas llamadas, pero les recuerdo que el Estado regula las playas. Vamos a tener información pronto sobre lo que podamos restringir. El centro Héctor P. García Wellness va a estar cerrado temporalmente, pero los centros de Greenwood y Rosetown continúan abiertos.
Well, just quickly, let me say thank you for tuning in, and for those of you that have been consistent watching these 5 o'clock briefings throughout this ordeal. We appreciate your consistency, and we appreciate you doing what we're asking. I suspect that the majority of folks that are watching are really in high compliance to our requests, and we want to thank you for that. We just hope that the community will continue to abide by those. I see a majority of people paying attention to them, and as I was out this weekend, I went to Home Depot and several other places, and they, inside the stores had the face masks, and outside the stores had the face masks with a few exceptions, but the majority of folks I saw going in would put their masks on, and while in the store they would do that, and we want to say thank you for that. And this really is the way we're going to win this thing, is all getting together and pulling in the same direction. So I want to say thank you. And it makes me proud that while our numbers are shifting around, I think what we did, the folks that got out and about when we opened up and started going places, we'd been so good, we just kind of took things for granted and let our guard down. But I think we've gotten everybody's attention, and hopefully they'll be back on the bandwagon and paying attention to it. Now, for those of you that don't like to wear masks, I don't like to wear them either. But if it's going to save me from exposing someone potentially, even though I've not had COVID, or keep me from getting it, then it's worth the effort. And so I'm asking you, in spite of whether you enjoy it or like it, to please respond to the request. And I think in the long run, you'll be proud that you did. Some good news is that while this is going on, the goodness of our people in the Coastal Bend has continued to show itself in its support for the Mayor's Disaster Recovery Fund. And to date, we've generated over $358,000, and we've been able to distribute $277,000 plus to nonprofits that are helping people, some in getting tests made, getting food, helping with utility bills, some other things. We've recently received another $26,000 in pledges that we'll begin to do some distribution in the next few days once those funds come in. And those have gone out to 21 different nonprofits throughout the community. This is not tax money. This is just the goodness of the heart of people in the Coastal Bend. And I think while we're hearing a lot of numbers and getting concerned about that, it hasn't affected the goodness and the generosity of the people of Nueces County and Corpus Christi. And I'm just so thankful for that. And working with Karen out at the Coastal Bend Community Foundation, they have been wonderful. They know which nonprofits need the help the most, the quickest, and we're trying to get those funds to them. I'm still getting some calls, and evidently the news hasn't gotten to some of these people. They've missed either the email or missed the news, but it was a disappointing decision that we had to make last week, but we have postponed the 4th of July fireworks. But what this does is present us an opportunity to gather as families over the holiday weekend and really focus on celebrating as a family the goodness of what we have in America, cook our hot dogs or whatever we do with family. And at some point in the future, those funds that were given to cover the fireworks through HEB, they said we'll have that fireworks celebration when more people can attend and not be afraid to get out and gather. And so it will be a double celebration when we do have the fireworks, that one, we're past COVID, and we can just, again, say thank you for being able to live in America and celebrate the 4th of July. We've heard of Christmas in July. Well, we may have July and Christmas this year. I just don't know. But we will have a fireworks. I can't tell you when, but it will not be this 4th of July weekend, and it's for the safety and health of our citizens, and I think that is probably one of the most patriotic decisions and jobs that we as leaders have, is to do what's right for our citizens, and that's following our oath of office and securing the safety and health of our citizens. So we want to appreciate that. And one other thing is that I think Peter or maybe the judge stated it, but sometimes the numbers are a little confusing in that there's probably more tests out there that have been, well, I know there's more tests out there that have been given, but those numbers haven't come in because the results lag behind the actual tests given. So don't be discouraged if you see that there are, 0 tests today. That just simply means in many cases that we just don't have the results. And so there may have been 300 tests that were given, but it shows 0 because we haven't gotten the results back. So they do lag, so don't give up, don't get discouraged, because I can assure you that from the governor to the county judge to the city manager, myself, we're doing everything we can based on good data, trying to make the right decisions. Now, there's a lot of Monday morning quarterbacks out in the community, and we appreciate your suggestions, but we're trying to do it on hard facts and data to be the best that we can in the positions that we've been given. And I'm appreciative of the fact that I'm in this position to help. I want to try to do the best we can, and the judge the same, and the city manager. And you can't say enough about the health workers, the doctors, the nurses, and all of those that are working in the system. You just don't realize the number of hours that they're giving and the energy that they're putting forth on the behalf of the citizens of this community. So if you know your doctor or his staff, or you know someone in the medical profession, next time you see them, thank them, express your appreciation to them, because many times while you and I are at home resting in the evening, they're in the clinics and in the hospitals working. And so they really do deserve our appreciation. And so we look forward to continuing to fight this battle. And I think with the new implementation of the governor's orders of last week, hopefully, and I'm praying that the numbers will begin to go down, and that the new cases will continue to go down and the recoveries will accelerate up as quickly as possible. And I'd like to reemphasize the judge's request that if you have the opportunity to go and donate blood, that is needed, not just for the COVID patients, because there are many patients out there, and under the governor's order, many elective surgery patients, that's been postponed. And some of those that are elective may turn into emergency, and they're going to need some blood. So we want to make sure the blood bank does have an adequate supply. And again, the goodness of this community, I think, will respond. And so we do ask you to participate in that. So maybe tomorrow, hopefully tomorrow, I'm optimistic tomorrow that the numbers will be better than they are today. And that will conclude my remarks. And thank you very much.
Les sigo pidiendo a los residentes que no bajen la guardia y hagan lo posible por evitar más contagios. Use su cubrebocas, que va a ayudar a evitar más contagios. Nuestra fundación ha reunido $350,000 en donaciones, 277,000 de esos ya han sido distribuidos a 21 agencias sin fines de lucro para poder ayudar a los residentes que más lo necesitan. Tuvimos que posponer la celebración del 4 de julio, por lo que podamos hacer es celebrar en familia. Ojalá y podamos festejar en un futuro una vez que haya pasado la emergencia de salud. La decisión se tomó para proteger la salud de nuestros residentes. Recuerda que los resultados que damos a conocer en ocasiones llegan posterior a la fecha en que se llevan a cabo las pruebas. Quiero agradecer también a todo el personal médico que ha ayudado a nuestra comunidad. Cuando los vean, agradezcan, ya que merecen todo nuestro aprecio. También esperamos que con las órdenes alteradas por el gobernador aminoren estos casos por el virus.
I'm back. I had the opportunity to draft some language earlier this afternoon, and I've just gotten, enough time to where we've been able to vet this language, and I don't want anyone to be surprised. So tomorrow morning, we intend, the city and county, to issue a reverse alert, and this will be a COVID advisory, and I'd like to read it to you and encourage you to sign up for reverse alert if you're not already on it. I know there are thousands of people that do subscribe, and it's an excellent way to receive important information that affects your community. Our reverse alert will read as follows. The COVID-19 virus is spreading rapidly across Nueces County. Our local hospitals and clinics are strained as hospitalizations rapidly increase. Protect yourself and your family. If you are a part of a vulnerable population or have health issues, it is best that you stay home, except for essential activities. Wear a face covering when in public settings. Continue to social distance and avoid gatherings with people outside your household. Stay safe. And then for more information, and we list both of our city and county websites. Again, this is a COVID advisory, and I think it's going to be very important that you sign up so you can have the most up-to-date information. And we look forward to the continuation of sharing what's happening with the latest info. Appreciate it.
El día de mañana vamos a emitir un aviso que será enviado mediante el servicio Reverse Alert. En parte, ese anuncio va a decir: el virus COVID-19 continúa dispersándose, las hospitalizaciones han incrementado, quédese en su casa, evite grandes grupos, recuerde practicar el distanciamiento social. Más información la va a poder encontrar en los portales de gobierno. La dirección es www.cctexas.com/coronavirus. Si quiere registrarse para Reverse Alert, puede hacerlo a reversealert.org.
Okay, that concludes our prepared comments for this afternoon. Is there any questions from the media?
I have a couple questions.
Okay.
So about the state-supported living center, I know that I talked to Annette earlier. She said there are 44 cases. You mentioned also that a lot of the staff from the possible testing tomorrow will be going to different facilities, including the state-supported living center.
Right.
What other facilities are there that we need to be aware of?
Right, the nursing homes. So we have several outbreaks taking place at over 10 nursing homes in our community. And so the staff is going to be going there to be doing testing and to check their protocols and see how the support staff that's at the nursing homes can help with the situations.
And I guess moving forward with the state-supported living center, in your opinion, I guess just from community leaders in general, what does this mean moving forward? What is the message you guys want to get out since this spike continues to move up?
Yeah, the message is the one Annette Rodriguez, our public health director, showed, which is the one we've been talking about for months, which is follow those basic protocols of social distance, wear a face mask, keep your hands clean, don't touch your eyes, ears, nose, or mouth. Don't hang out with people you don't know. Minimize travel. If you don't have to go out, don't go out. The virus, as we have talked about for months, is a very tricky virus. You can't see it. Our body has no immunity to it. There's no cure, right? No readily available cure. So the best cause for a cure is to not get it at all, right? So.
And my last question, are you knowledgeable about any of the information of the State Supporting Living Center having to do with, I know residents are in their isolation unit, but those employees, are they also being isolated at home?
That I don't know about, but I think the health department is helping. That's one of the things they'll be managing. They have been working on it really since last week and all weekend, and that'll be some of the work they do tomorrow is to check the protocols, the work set up, and that type of thing.
Thank you.
You're welcome. Yes, sir.
I don't know if you can answer this or the judge can answer this
Okay.
about tracers. Is that a health department question?
Yeah,
About,
yeah.
What are the criterias and what do people need to do to apply for those positions?
Okay, well, we have tracers in our department right now, the joint city-county health department, and we've reassigned staff from the organization to help with the tracing, and in addition to that, we're working with a firm to get some additional staff from a temporary service agency to get additional tracers. So, I don't know, Judge, if you want to add additional comments?
Just that the state of Texas, the governor gave this role to the ag extension departments. Every county has an ag extension agent. And so through those agents, they have really received top-notch training from the Texas Department of Emergency Management. And so when we need more contact tracers, we do make that request. We had already made that request when we started seeing our numbers. Remember when we were at 25? Remember those good old days when 25 seemed like a lot and we were worried about 25? So that's where we expect is to have them who are already certified and trained in the correct protocols to be able to assist us as we see the volume just build and build.
Are they here now?
They're
or-
here now. Mm-hmm.
And how many are those?
Well, initially they sent us 6, and then they keep, training more and more. But our own staff was over 25 at one point. So we have our own health department staff. And I think, like anything, we all can be contact tracers. I tell everybody at the county, don't wait for someone to call you. You know who you've been in direct contact with. Preemptively call them and let them know that you've been diagnosed positive, and they should do everything they can if they were in direct contact with you and you weren't protected to isolate and to see if they need to be tested as well.
If there's somebody out there with this kind of experience?
Yeah,
who
if they
can
had
call?
experience, I would say reach out to Health Director Rodriguez's office and let them know that you've done this before, maybe in a previous career, and maybe there's a place for you. But I want you to know the state was very thoughtful about this, and they were really they created this system of training through the Ag Extension Agent, and the reason is that every county in Texas had one. So it was such a great way to systematically create consistency in training.
How would the city or county respond to citizens criticizing the messages on COVID-19 as generating fear?
Generating fear?
Yeah, you want to take that, Judge?
Sure. I always like the easy ones. I think that there is something to fear. I think there is something to fear in that our businesses are in jeopardy again. Our workforce is in jeopardy. And I think we need to make sure that we have just enough worry in us to make sure we're going to act and responsibly. I don't believe the messages are driven by inaccuracies. I think they're data-driven. I think I'm very careful to really look at the data to make sure that our decision-making is very connected to that nexus. And, I really don't know what else to say except for that it's very clear to me that when you have, 80 people in the hospital in a week's period of time, when we were in the teens, and when you have, 30 people in ICU, when we literally could count them on one hand, that is something that needs to be respected. And what we're trying to do is make sure that we can keep all of us safe and make sure that we can keep our community functioning. I don't want to see Nueces County be one of those counties that has to restrict elective surgeries, because we know elective surgeries are important to our community. But we are drifting into that danger zone. And so it's important that people understand what's at stake. I don't consider it fear, I consider it consequences. And for every action, there is an equal and opposite reaction. That is also a scientific law, but it's one that makes a lot of common sense. So whatever we do today, in fact, I've said all weekend, that this week, July 4th weekend, more than any other, will determine our fate for the month of July. And so, does that sound fearful? It sounds accurate to me.
One last thing, Judge, on going back to the beaches, at what point do you say, I know you're getting clarification, but at what point do you make the decision whether the beaches stay open because of what happened on
Right.
the Memorial Day weekend?
So I wish I could, but it's just out of my hands. You know, there are certain things that we all say our roles are very defined. And in emergency management, I do have a lot of latitude with regards to ingress and egress, but when it comes to Texas beaches, by constitution, they are open beaches. And so they are not in my hands to regulate. It's in the hands of the General Land Office. However, there are things that we can do, like restrict the time frame that people can be on them. We can restrict the access roads. And I think that's something that is best done in cooperation. What I'd really like to see is, something consistent so that South Texas beaches from here all the way down to the valley, are treated the same. That will help people who are coming to our area understand what the rules are, and it will help our locals as well if we can create a consistent message for all South Texas beaches.
I just did want to add one thing. So I mentioned we have a request into the state for testing materials, and State Representative Todd Hunter texted me during the briefing to forward to me a message from the Emergency Management Organization of Texas, so the Texas Emergency Management Department, and they have our request, and they said they're processing it, which is good news. So hopefully we'll get that material this week, and then we'll be able to continue our testing as we had last week. Judge,
I just want to add that there were 21 different requests that went in, everything from swabs and pipettes to lysis buffer to nucleic acid. And each of those requests took hours to get into the system this morning. And our entire legislative delegation this weekend was put on alert, and they were so on top of it that they got to TDM before our data entry on the requests could get to TDM. So yes, the requests have been received by the state. The state is aware of our situation. And I just got a question from another journalist, are you optimistic about receiving these resources? The answer is absolutely. The state has not let us down yet, but everybody is clamoring for the same types of materials. But we have done, I think, our best to put forth the need. And as the hot spot, I think that these resources are best used here. I also want to be honest with you. There are over 2,000 people waiting to be tested, and that is a significant number. And although I'm waiting for these resources patiently, and I know they'll do their best, I want you to know, if you were in line, I'm going to not rest until you get that test this week. I'm going to ask for your patience, but I'm going to tell you that when we set our mind to doing something here in Nueces County, we get it done. So I know there's a lot of you, and I know that there's a lot of worry. But make no mistake, you are doing the right thing by isolating at home, and we are going to get you these tests as soon as possible. And again, let us know if you want to know a little bit more information about the testing. There was also a major star request for remdesivir. That's the medication that can also be very helpful in the treatment of patients. So Nueces County has a lot of asks out there, and we expect that they will be, well received. We're about to, make sure that we can get an ask also so that we don't have to hold back resources for emergencies. We'd like to make sure we could get a team to come down here and help us with these nursing homes from the state. So there's many ways that we can partner with the state, but they use our resources first, and when we run out of ours, we go to theirs. So let's hope that they come quickly.
One last question.
Yep.
Going back to the blood, how many times can a COVID patient?
Great question.
Keep giving blood?
So every 28 days is the current rule. Every 28 days, but they're changing constantly, and if you're a very healthy person, we might even be able to get you to do it every 2 weeks, every 14 days. But currently, the rules that are set up are every 28 days, you can be a giver. And again, like the mayor said, I mean, if you want to be a part of the blood bank's normal, giving program, we invite that. But I am really targeting our COVID-19 recoveries. And like I said, 272 of you. And this age bracket that we talk about, this age 20 to 49, that really has probably over 50% of our recoveries. You guys communicate on such an interesting social media level and platforms. I want you to use those platforms. I want to see calls by you asking people that family, friends that have recovered from COVID to come and call that number and see how they can be a giver. You don't have to use old-fashioned mediums. I'd love to see a TikTok, send them to me at barbara.canales@noisisco.com. I want to see your in creative ways to get people to know about what we're trying to do to save lives. And by the way, in our most vulnerable arenas, like our nursing homes and at the state school, we'd like to be able to take convalescent plasma therapy to them there at their location so they don't have to go to the hospital. So this is, me, I like to talk about 10 subjects, not one. When I focus on one, like convalescent plasma therapy, that's your signal that that's the most important thing to me today. And so I hope that I want to hear those phones ringing this evening, and we will be with you first thing in the morning with appointment scheduling. Thank you so much.
Okay, I think that's going to conclude it for today. So we will be back here tomorrow at 5, and as well as Wednesday and Thursday. Dr. Bird will be here on Thursday because we won't be here Friday, just one day, so Thursday instead of Wednesday. All right, we'll see you all later. Thank you.